Nuts about health. For decades, nuts have been praised as nutritional powerhouses, tiny kernels packed with protein, healthy fats, fiber, and essential vitamins. But for seniors, especially those over 60, not all nuts are created equal. Some nuts can aggravate joint inflammation, spike blood pressure, or contribute to unwanted weight gain, while others can lubricate joints, strengthen your heart, and even improve brain health. In this in-depth guide, we'll explore 4 nuts seniors should avoid, 4 nuts you should eat regularly, the science behind their effects on aging bodies, how to prepare and portion them properly, nut-based recipes for joint and heart health. Let's crack the truth about nuts for seniors and discover how a handful a day can lead to stronger joints, a healthier heart, and a more vibrant life. Chapter 1. Nuts and Aging, the Double-Edged Sword. The nutritional power of nuts. Nuts offer healthy fats, monounsaturated and polyunsaturated, plant-based protein, antioxidants, vitamin E, selenium, minerals, magnesium, potassium, calcium, fiber. But for seniors, the key issue isn't just what's in the nut. It's how it affects inflammation, blood pressure, joint function, and metabolism. Why some nuts are problematic after 60. High omega-6 fatty acids promote inflammation when not balanced with omega-3s. Salted or roasted with oils lead to blood pressure spikes and trans fats. Hard textures, difficult to chew and may damage dental work. Calorie dense, easy to overeat and gain weight, stressing joints and the heart. Chapter 2. The 4 nuts seniors should avoid. 1. Peanuts, especially salted or roasted. Why to avoid? High in omega-6 fatty acids, which fuel inflammation. Often processed with hydrogenated oils and high sodium. Mold-prone, aflatoxins, which may be carcinogenic. Better alternative, almonds or walnuts. 2. Brazil nuts in excess. Why to avoid? Extremely high in selenium. A single nut contains 95 micrograms, over 150% of daily value. Excess selenium can cause nausea, fatigue, hair loss. Better alternative, pumpkin seeds or sunflower seeds for trace minerals. 3. Macadamia nuts. Why to avoid? Very high in calories and fat, low in protein and fiber. Expensive, encouraging people to buy pre-seasoned varieties. Better alternative, pistachios, lower in calories, more fiber and protein. 4. Cashews. Why to avoid? Contain high levels of phytic acid, which can impair mineral absorption. Often roasted in oils and heavily salted. Not ideal for joint inflammation due to low omega-3 content. Better alternative, walnuts or flaxseed. Chapter 3. The 4 best nuts for seniors. 1. Walnuts, the king of brain and joint health. Key nutrients. Rich in ALA, plant-based omega-3. Contains polyphenol that reduce oxidative stress. Benefits. Reduces joint inflammation and arthritis. Improves cognitive function and memory. Supports heart health. How to eat. 5 to 7 halves per day. Mix into oatmeal or yogurt. 2. Almonds, the heart helper. Key nutrients. High in magnesium, vitamin E, and fiber. Benefits. Lowers bad cholesterol, LDL. Supports bone health and reduces osteoarthritis symptoms. How to eat. Raw or lightly toasted, no salt. Almond butter as a healthy spread. 3. Pistachios, the smart snack. Key nutrients. Rich in B6, potassium, and fiber. Benefits. Boosts circulation and blood pressure control. Aids in weight management. Improves eye health. Contains lutein and zeaxanthin. How to eat. In-shell versions promote mindful eating. Add to salads or rice bowls. 4. Flaxseed and chia seeds. Tiny but mighty bonus seeds. Key nutrients. Extremely high in omega-3s, fiber, and lignans, antioxidants. Benefits. Reduces inflammation in joints. Improves digestive health. Aids in blood sugar control. How to eat. Ground flaxseed in smoothies. Chia pudding with almond milk. Chapter 4. Joint and heart health. How nuts help. How nuts fight joint pain. Rich in anti-inflammatory fatty acids. Contain magnesium, which helps relax joints. Antioxidants fight oxidative stress in cartilage. Study highlight. A 2020 review in nutrients found that diets rich in omega-3s significantly reduced rheumatoid arthritis symptoms. How nuts support heart health. Lower LDL cholesterol. support artery flexibility, prevent plaque buildup, help maintain healthy weight. Study highlight: a Harvard study followed 210,000 people over 32 years. Those who ate a handful of nuts daily had a 25% lower risk of heart disease. Chapter 5: Portion Control and Preparation. Recommended servings. Nuts, 1 ounce, about a small handful per day. Seeds, 1 to 2 tablespoons daily. Healthy nut tips. Choose raw or dry roasted nuts, unsalted. Store in cool, dry places. Nuts spoil. Avoid trail mixes with candy or dried fruit. Watch for dental issues. Chop or grind if needed. Digestive discomfort. Introduce slowly. Allergies. Monitor even mild reactions. Chapter 6: Recipes for strong joints and heart. 1. Walnut berry oatmeal. Ingredients: half a cup oats, 1 cup almond milk, a quarter cup blueberries, 1 tablespoon chopped walnuts. Cinnamon. Benefits: omega-3s, fiber, antioxidants. 2. Almond energy balls. Ingredients: 1 cup rolled oats, half a cup almond butter, 2 tablespoons flaxseed, 1 tablespoon honey, dash of vanilla. Benefits: bone health, protein, magnesium. 3. Chia seed pudding. Ingredients: 1 cup unsweetened almond milk, 3 tablespoons chia seeds, half a teaspoon vanilla, stevia or maple syrup, optional. Benefits: omega-3s, gut health, low sugar. 4. Pistachio-crusted salmon. Ingredients: 1 salmon fillet, 2 tablespoons crushed pistachios, olive oil, lemon juice. Benefits: omega-3s, protein, vitamin D. Chapter 7: Myths, Truths, and FAQs. Aren't nuts too fattening? No. Eaten in moderation. Nuts actually support weight loss due to satiety and protein. What about nut allergies? If allergic, try sunflower seeds, pumpkin seeds, or hemp hearts. They have similar benefits. Raw versus roasted? Raw, higher in nutrients. Roasted, more digestible, tastier, just avoid oils and salt. Can I eat nuts if I have high cholesterol? Absolutely. Walnuts, almonds, and pistachios are proven to lower LDL and raise HDL, good cholesterol. Conclusion: build your daily nut ritual. As we age, every bite counts, and a small handful of the right nuts can make a big difference, reducing inflammation, boosting your heart, and protecting your joints. Here's the simple takeaway: avoid peanuts, Brazil nuts in excess, macadamias, cashews. Choose walnuts, almonds, pistachios, flax/chia seeds. Start small. Add walnuts to your breakfast. Swap peanut butter for almond butter. Keep a jar of pistachios in shell for mindful snacking. Within weeks, you'll feel the difference. Less stiffness, better energy, improved blood pressure, and peace of mind that you're feeding your body what it really needs. So the next time you reach into the pantry, remember, the right handful of nuts isn't just a snack. It's a step toward a stronger, more mobile, and heart-healthy life.